All right, let's talk about something that's honestly a game changer in women's health, regenerative vaginal treatments. And look, this is about so much more than just aesthetics. We're diving into a really important conversation about restoring function, rebuilding confidence, and truly investing in our health for the long run.
So, here's what we're going to cover. First, we'll meet the amazing expert behind this approach, Dr. Farzana Khan. Then, we'll dig into the clinic's whole philosophy, break down the science of how these treatments work, tackle your biggest questions, and finally, look at what it means to plan for wellness for the long term.
First things first, let's talk about the expert. You know, when it comes to treatments that are this personal, the person you're trusting is everything. Their expertise is the absolute foundation for getting a great result, and that's exactly why we're starting with Dr. Farzana Khan.
Think about this. Over 2 decades of medical experience. But what's really special here is Dr. Khan's combination of skills. It's like she's built this incredible bridge between the deep medical knowledge of gynecology and the advanced techniques of aesthetic medicine. That blend is so rare, and it's what makes her approach totally unique.
Okay, so let's just look at this journey because it's seriously impressive. You see the solid medical degree, the specialization in gynecology, the extra diplomas, all fantastic. But here's the part that really blows me away. That 2023 update. She's not just using the technology, she's a key opinion leader who actually trains other doctors for the very companies that make it. That's a whole other level of expertise.
And this is what really separates the best from the rest. She's not just coasting on her qualifications. She's constantly learning, going to top international conferences, and getting trained on the absolute latest techniques like PRP and advanced lasers. So what does that mean for you? It means you're getting access to the most cutting-edge, effective treatments out there. Period.
Okay, so you've got this incredible world-class expertise. But how does that actually feel when you walk into the clinic? Well, it becomes the heart and soul of the clinic's entire philosophy. It's what lets the Women's Health Clinic create an environment that's all about the patient.
I just love this. It's so much more than a catchy phrase, right? Rediscover confidence by women for women. That says it all. It tells you this is a safe space built on a real understanding of women's health. It's a place where you're not just a patient, you're a partner, and you're met with genuine empathy.
And let's be really clear about what we're talking about here. This isn't just about minor cosmetic stuff. The clinic is tackling real, life-impacting conditions, things like genitourinary syndrome of menopause, stress incontinence, painful intercourse. You know, the deeply personal issues that can really affect your quality of life and deserve the absolute best, most compassionate care.
So this brings us to the really fascinating part. How does this stuff actually work? Well, I can tell you it's not magic. It's brilliant science that's all about one thing: waking up and boosting your body's own incredible natural power to heal itself.
Now, the first thing to know is that a full treatment usually takes about 2 to 3 sessions, and there's a really good reason for that. This isn't a one-and-done deal, because we're working with your body's own natural timeline for repair, which we're just about to get into.
It all comes down to that one powerful word, regenerative. So what does that mean? Well, think of it this way. Instead of just putting a Band-Aid on a symptom, these therapies are like a wake-up call for your body. They kickstart the process of building brand new, healthy tissue, creating new blood vessels, and rebuilding that all-important collagen from the inside out.
Okay, this is so cool. This slide explains exactly why the sessions are spaced 4 to 6 weeks apart. Your body has this natural 3-step process. First, for a couple of weeks, it sends in the emergency crew to clean things up. Then, for the next few weeks, it brings in the construction team to build new collagen scaffolding. And finally, the finishing crew comes in to make all that new tissue strong and resilient. You just can't rush biology.
Okay, the science is amazing, but let's get down to brass tacks. What does this all mean for you and your daily life? It's time for a little rapid-fire round to answer some of the biggest practical questions people have. The classic question. Everyone hears the phrase minimal downtime, but what on earth does that actually look like in your schedule? Let's break it down.
So in the real world, it means you can probably head right back to work on the same day. The main things to remember are pretty simple. Just avoid tampons or intercourse for 2 or 3 days, and maybe skip the hardcore workout or swimming for about 48 to 72 hours. It's all about being smart, not about putting your entire life on hold. Totally manageable.
All right, let's tackle a huge myth right now, the idea that this is a one-and-done permanent fix. The reality is, these treatments are incredible, but they don't press a pause button on the aging process. Our bodies continue to change, so you have to think of this less like a single repair job and more like an ongoing wellness strategy, where a little bit of maintenance each year is key to keeping those amazing results.
And that idea of ongoing care brings us perfectly to our last section. It's all about reframing this as a long-term strategy for your wellness and understanding all the powerful tools you have in your toolkit to stay feeling your best.
This chart is a great way to see your options at a glance. You can see how each protocol is designed for a different purpose. For laser and RF, which rebuild tissue, they follow that natural 4 to 6 week healing cycle. But then you have something like Emcella, which is like sending your pelvic floor muscles to boot camp. It's a workout, so the sessions are much closer together. It's all about choosing the right tool for the job.
So if you take away just one thing from our chat today, let it be this: maintenance is a non-negotiable part of the plan. It's not about fighting aging. It's about working with your body proactively to make sure you can enjoy the benefits of your treatment for years and years to come.
And that leaves us with a pretty powerful question, doesn't it? We're seeing this huge shift in healthcare, moving away from just reacting to problems after they happen and towards a smarter model of proactive, long-term wellness. So when you think about it, could this focus on regeneration and maintenance be the true future of women's health? I think it just might be.